We come to the next session, something to do on medical education. And we have got Dr. Dujeepa Samarasekera from the National University of Singapore. And I'm expected to introduce him to you. I think I'm the most suitable person because if I'm not mistaken, I have known him from the time he was born, when I was a first-year medical student. So therefore, he has undergone my discipline, and he's a totally different personality, I'll tell you that. Because I found him once when I came home, he had painted my Cunningham's dissection manual, and I can't tell you the punishment I gave, but since then he has behaved very well. So Dujeepa graduated from the University of Colombo, Sri Lanka, with honors in 1995. He wanted to actually do pathology after the internship and pass the qualifying examination in pathology, but later decided to take up medical education as a career and join actually the Department of Medical Education in this university. And continued his postgraduate training in health professions and education at the University of Maastricht in the Netherlands. After completing his postgraduate studies in the Netherlands, he joined National University of Singapore. At present, Dujeepa is the Senior Director at the Center for Medical Education, School of Medicine, National University of Singapore. He also holds the portfolios as Senior Advisor to the Center for Development of Learning and Technology, National University of Singapore, and is a Senior Consultant with the Ministry of Health, Singapore. He leads the School of Medicine Continuous Quality Improvement Team for Education and is a member of the Medical School Review Committee at the Ministry of Health, Singapore. He has international experience in reviewing medical schools and standards globally. He was the inaugural elected president of the College of Clinician Educators in Singapore and was the president of the Western Pacific Association of Medical Education in 2018 and 22. Dujeepa has won many accolades, such as NUS School of Medicine Special Recognition Award as a role model in 2015, Resident's Choice Award by NUHS Residency Program, Value in Action Award for Excellence in Innovation by National University Health System, Miles Award given for mentoring, innovation, and leadership in educational scholarship, NUS Virtues Award for Excellence and Dedication by oneself contributing to service under difficult circumstances due to COVID in 2021, and Motta Riadi Pinnacle Award for Excellence in Education in 2022. He was honored by the Singapore government at the National Day Awards this year and received the Public Administration Award for his contributions to health professions education. And he holds the degrees MPHE, FAMS, and FRCP, Edinburgh. May I invite Dujeepa to deliver his lecture, please.
Okay, thank you, Professor Samarasekera, for that kind introduction. I'm not really certain about the discipline part, but yes, he knows me from birth, I suppose. Okay, so today I'm going to share with you some of my thoughts with regard to how do we nurture values for impactful practice from learners all the way up to the professionals. As Professor Samarasekera mentioned, I'm from the National University of Singapore, Yongloo Lin School of Medicine, and from the Center for Medical Education, where we focus on scholarship of teaching and learning, as well as faculty development and curriculum development. I have to start off with a disclaimer, as required by my institution. The ideas and views expressed here are entirely mine, based on my personal experience as a health professional, and the views expressed do not represent any institution or organization unless otherwise stated or referenced. Well, the focus of the next 10 to 15 minutes would be on defining the values. What are they? And why do we need to focus on these values, especially in a procedural discipline like surgery? And then, of course, how can we nurture these values? And then some of the challenges and ways forward. from our own personal experience as well. Being a medical educator, I like to relate stories, so some of these are our own stories. So let's start very briefly with what are values. So values are defined or conceptualized as what affects decision making and how one operates in the world. Now, these are basically the principles or standards of behaviors, what is important in one's life. Values are also thought, which affect our life and also to which we attach importance and how we influence others and justify of self to the others as well. So these are in different ways how we define values. And the ethics sage actually nicely puts all these different definitions together as basic and fundamental beliefs that guide our motives and attitudes or action. They help us to determine what is important to us, what for us to focus on, and what is the motive behind some of the purposeful action. They are at the end to which we act and come in many different forms. So basically, values are our inner moral posture which guides our outer ethical response. And this is why it is important for all health professional practitioners, especially the proceduralists. So, pressing the wrong one. So why do we need to focus on values? Let's roll back for a bit. This is an excellent book by Hansen and Callahan. It's published somewhere in 93 and 99 period, the latest edition in 99. It says the goals of medicine is to prevent disease, to relieve pain and suffering, to care and cure, and to avoidance of premature death or the pursuit of peaceful death. And if you look at the 21st century healthcare, it is basically to develop a safe, effective, and a patient-centered practitioner who can actually engage timely and in an efficient manner and an equitable manner to provide quality care. So if you look back in the past, most of our practice was focused on the doctor developing its own sole expertise, and he was the sole provider of care, and it was centered around his knowledge. At the time of he graduated from the school or from a particular discipline, it was mostly gathered around that. However, if we fast forward to 21st century, the care is patient-centered. It is value-driven and cost-conscious. It's evidence-based and a coordinated care. Training, basically people to turn problems into questions and learn by questioning, and complement experience and knowledge from evidence-based data. And this is basically what we do with our students and our residents or registrars. We are also training them to be learning to work and learn with teams. And this is team competence. And team competence is becoming quite important in many places. Canada started this, that they are not only credentialing the individual practitioner, for example, like the surgeon, but they are also credentialing the entire team for their competence. And then, of course, you need to know how to work as a team player. And then, of course, how to construct knowledge as we go on in the continuum of learning. So this is 21st century care. But this is now, there's also a lot of challenges with this paradigm shift. First of all, commercialization of medicine. So the rising cost of medicine, profit-listed public hospitals, I mean, as you know, in all our public hospitals in Singapore are corporate organizations, even though that they are public. We have to make everything in black, including the medical school. In my department, I have to manage my finances. The university only pays only about half of my staff, and the rest I have to manage by creating opportunities. And then, of course, the trust between the patient and the doctor. Right? These are challenges due to commercialization. We also see increased regulation of medicine because of these challenges, right? Of the professionals and the hospitals and the institutions. So higher standards of accountability of hospitals and institutions, higher standards of accountability, of professional performance by practitioners. Not only that, there's also the medico-legal climate is changing due to patient safety, complexity of medicine, and leading to higher expectations from the patients and public. And this all leads to what we are seeing now increasingly, the burnout of healthcare professionals, especially this is critical in proceduralist care, specialties like surgery, etc. So it's a crisis at the moment in health manpower development. And we do see that this manifests, because of this crisis, this burnout, you can see that in the behaviors that these elements actually manifest out. So you can see that if you take, in many places, that there are challenges, especially taking care of their juniors, right, and the team. So these are critical elements that are coming out, and this actually erodes into that value sets, the beliefs that one has. So these are some of the challenges that we are facing, and it's not only in one place. You can see this across. So you can see the unprofessional behavior. This is from Singapore Medical Journal, recently published, on some of the challenges that the Medical Council is having with regard to some of the unprofessional conduct. Especially with regard to surgeons, you can see the unprofessional behaviors directly having an impact on patient care and making mistakes with patients. Of course, there's also quite a lot of evidence about unprofessional behaviors by surgeons with surgical complications in their patients. So these are all manifestation of these challenges and the burnout, and then the things that I shared as some of the issues facing the medical community. So again, I want to highlight this. Our inner moral posture guides our outer ethical response, and we need to be aware of this. So let's now roll back to some of the training issues and challenges. We actually, prior to this surgical congress, some of us, Professor Aluka Patirna, Professor Siva Ganesh, and Professor from PGIM, and also my colleague here from NUH, we got together and we sent out a survey, and we actually got some very interesting data. And we are running a workshop this Saturday morning, and it'll be quite interesting and engaging one, which are basically based on this survey. And I have highlighted and bolded some of the areas that directly linked with some of the findings from the survey. For example, for curricular and assessments, especially if you're looking at the surgical training right now, one of the things that was highlighted is that the less focus on developing critical thinking, behavioral, social, and attitudinal competencies of the registrars, who are going to be the future surgeons here in Sri Lanka. There's also issues with teaching, so teaching by humiliation, lack of respect for privacy and dignity of patients, then of the practice environment, the time pressures due to competing demands, and the clinical environment not learning friendly. It's so busy, the wards and other things, and you're just clearing out rather than really learning, critically evaluating and thinking through. So these are some of the challenges actually in the local setting that some of the trainees are facing. So this excellent paper by Timothy Brigham and Yakumo from ACGME. As some of you may know, that ACGME, they actually routinely regularly come to Singapore, because the Singapore, all our residency programs or the postgraduate specialist programs are accredited by the Accreditation Council of Graduate Medical Education in the United States, which also accredits their own specialty programs. They published this paper, and it is freely downloadable from the Academic Medicine Journal. And what they shared is that they did a survey from 2000 to 2014, and they found that the highest cause of death in the residents, or what we call in here the registrars, after taking out neoplastic diseases like cancer and all that, in the US, is suicide. And that was really shocking. And the suicide rate is highest in the second year of their postgraduate specialty training. And this actually has got the entire ACGME accreditation process to really focus on the well-being of the trainee and the training environment. And these are the ones that can erode one's own ethical values, the belief sets, etc. They get so frustrated with the system once they become a fully fledged consultant or a junior consultant, they have completely lost it. So therefore, there's a lot of focus now on these aspects. And that is true because practice of medicine is very complex. It's an imperfect science. Knowledge is vast and complex. The patients are usually unique and complex human beings. We are not treating robots, they are human beings. The patients are also vulnerable, and the information at the beginning may be incomplete and uncertain and quite limited, and the clinical judgment may change as you go continuously into investigating the patient and or even at the surgery itself. So clinicians are also expected to humanely and timely and consistently treat patients. But however, we all know we are fallible professionals. We are human after all. There's a nice book in medicine, health professions, and it's termed as "To err is human," right? So we need to understand this. It's a complex nature. So how, as you say, that the values are needed to provide quality care, to retain good doctors so that they don't get burnout and leave, and then also we need to keep them in the system. And this is why we focus a lot now in values. So this is our undergraduate program, and we have now clearly articulated the values that we want to build in, to incorporate, not only to the students, but also to the faculty members and the other stakeholders. So these values like humility, compassion, integrity, and respect, we have specific programs. And what we have found is that this builds resilience in our students. And these teaching learning are deliberate, and the feedback is given at different time points. And in the undergraduate program, we call it the Enrich program. And it's the same in our postgraduate program for surgery, medicine, the postgraduate program. So this is our National University Health System values. It's a teamwork, respect, integrity, compassion, excellence, and patient-centeredness. These are also evaluated at different time points, and timely feedback given, how well they are developing. And if there are any issues, to quickly intervene and to remediate. How do we do that? A key is the role model, right? So that is really important. And this is something that we put specific emphasis. And one of our sister medical schools, Duke NUS School of Medicine, is a graduate medical school. They actually have a compact between the trainers and the residents and the students with regard to the ethical and the professional behaviors. So it's a compact that they sign at the beginning. Of course, this is really important. Why? Because when you engage in this in the right way, there's the immediate is to nurture, to develop the right value sets. And in the future, this actually to translate into professionals who are caring, compassionate, and collegial. And feedback is an important and essential component. First, you make the awareness, then the learning component, the deliberate learning and feedback, and then you observe the change in behaviors. Well, there are some challenges. What are some of these challenges? I have listed it down, right? So again, a lot depends on the trainer actually, rather than the trainee or the student. So these are some of the challenges that we need to focus on, and from context to context, from situation to situation, it can be different due to different socio-cultural differences and the value sets within certain communities or within the institution itself. And there's this very interesting article. This is the Asia Pacific Scholar is our own journal, which is indexed in Scopus as well. And I invite all of you to contribute articles to the NUS journal in health professions. Anushka Sinathambi is one of our very bright and very intelligent residents in pediatrics. She actually wrote a very reflective piece, Are the Values Valued in Healthcare? And it's something that I would encourage all of you to go. It's again freely accessible and can be downloaded as well. So how do we do that? We build that reflective ability to appreciative inquiry, what we call, through a process of appreciative inquiry. So there are different frameworks which I'm not going to go into, which we have incorporated into our Enrich program for students and residents. And then what we are really looking for is this transformational change. So putting their beliefs, values, and vision into the change. So with that, I just want to summarize that nurturing values, you need to start early, especially in the training, and continue throughout their program. You need to create that safe environment for trainees to discuss, to think about, to reflect, and challenge their past experiences for that transformative change to happen. The supervisors need to be trained, and that's where the faculty development must come in. And as I said, that's the critical piece. Not the trainees, not the students. It's the faculty and the supervisors. And then, of course, you need to provide the systematic feedback, not only to the trainers, but also not only to the trainees, but also to the trainers. So with that, I want to acknowledge the College of Surgeons and the conference organizing committee. It's a pleasure and a privilege to be here and sharing some of my thoughts, and to my colleagues, Professor Tirumurthy and Chen Si-seong, and of course my colleagues at CENMED and all the participants. Thank you very much.
Thank you very much, Dr. Samarasekera, for that very clear and precise presentation, and there's a lot of things for us to think about. We got a few minutes, about 5 minutes for questions, if anybody has any urgent questions to ask Dr. Samarasekera.
Dujeepa, can I ask you a question now? NUS is number 8 in the world rankings, and number 1 in the Asia Pacific, ahead of even Australia, Korea, other countries. Why, and what is the secret? Because I don't know, I think we are in thousands, so, but what is the secret of becoming first in the Asia Pacific region and number 8 in the world?
Wow, that's a very difficult question to ask, to answer. I think probably my colleagues sitting over there, Professor David Lamento, Sujit, and they might be able to share their thoughts. But I think from my perspective, from what I have seen over the last 15 years, it did not happen overnight. So it was a systematic engagement, starting with a good vision. Some of my mentors, Professor Matthew Gui, who has retired, who has seen it all, he shares with me, he came to Sri Lanka as a junior faculty member for NUS somewhere in late 70s to Peradeniya, and he said that when they were talking that, we must make NUS like Peradeniya in 1970s, mid-70s or late 70s. So it was through what my current dean, Professor Changyap Singh, he says that somewhere in 1980s, the vice chancellor, now called the president of NUS, he had a vision on how to make it to one of the top institutions in the world. And with that, it was a systematic approach. As we started, he said that we did not have much money, so it was a very planned and a systematic process. And there are very clear, what you call, targets with key performance indicators, and networking, international networking as well. So engaging in that systematic process actually helped us to slowly build the reputation, as well as the research, education, and service enterprises in a more cohesive way to be what we are today.
Thank you. Any other questions? Thank you. In the interest of time, may I please request Professor Samarasekera to hand the token of appreciation to his brother. Thank you.